We're gonna adjust the mid-back now, so deep breath in, all the way out. Good. Good, nice and easy. Just relax. Perfect, good. Good, drop your right shoulder. Perfect, whew. Turn your other right a little bit. Oof, beautiful. What's up guys, Dr. Drew here, back on the channel at Hawkeye Chiropractic in Arlington Heights. If you haven't already, make sure you hit that like and subscribe button, truly appreciate it. Helps us make sure that we can have you guys see these videos first and foremost. So today I'm with a special guest. This is Jasmine. She's been a patient with us for about 3 months now, is coming up on her final x-rays, continuing from her beginning to her end with her corrective care program. And this is where we typically see a huge shift in those x-rays where hips before were in a line as well as the spine. So originally Jasmine came in about 3 months ago with lower back pain. She's a corporate worker, specifically working for a tax accounting firm. So she does a lot of testing with whether it's 401ks and things like that to make sure they're compliant with the IRS and anything like that. So I'm gonna let Jasmine just tell a little bit about herself, what she does on a day-to-day basis from where she was as far as sitting all day to now how we have her sitting, standing, and essentially keeping her spine mobile. That way she can do her job at 100%, but not have her job cause her to be in pain by being stuck on the computer. Especially now with tax season, she's super busy. And she's gonna tell you she loves Netflix too, so she might give you a referral on a couple series to watch. But Jasmine, just tell the viewers a little bit about yourself and kind of what we do here at Hawkeye.
So I came in roughly about 3 months ago. As Dr. Drew said, I work for a tax accounting firm, so I'm mostly 90% sitting. But luckily in the office, we have standing desk. So now since coming here, I would say I went from 90% sitting to at least like 75, because most of the time I stand most of my days in the office now. Now that we're shifting back from less remote days because of tax season, I'm going in more, so I'll be more mobile because I go from my desk to the processing room. So I would say my standing would go down to at least like 50%.
It's huge.
Yeah.
So also, like, again, she's in the heat right now as far as tax season. So her days aren't just 8 hours. So your days are what, typically 12?
Yeah, sometimes.
14-hour long days. Any of you guys accountants out there, are you guys working with deadlines? Specifically in the first couple months of the year, these deadlines are very, very quick to come up. So her workload, she might be working 40 hours one week and then 70, 80 hours the next week. So a lot of repetitive stress, a lot of stressful environment situations, making sure things are done on time. And just by getting her to this point, she's going to have great success throughout the rest of the year with everything else. But what we'll do now is we're going to go ahead, go through a typical workup. We're going to focus on our lower back, do some soft tissue, some orthopedic exams. Again, if you guys have any comments or questions, anything you guys want us to answer, or if you want us to do a specific video topic, definitely make sure you leave those in the comments below. All right, guys? All right, guys, so first thing we're going to do is just take a look at these hips. And what I'm doing is just feeling for the top of each pelvis here. Good. So here's the top of your right, here's the top of your left. Which one do you feel higher?
My right.
Exactly. Okay, which means that the right hip is shifted up, left is shifted down. Let's take a look here and see if that confirms on what we were talking about. And just like that, you guys are going to see that this right leg is short, about 1/2 inch specifically. Good. Just relax. And then again, we're going to see this right leg go long here, which is going to also give us a positive indication that that right pelvis is shifted up, okay? So before we do any type of adjustments, like you guys have seen on the videos before, we want to just wake up that tissue specifically to allow it to make sure that it's not pulling when we do adjust that pelvis, that tailbone, and those lower back muscles. So first thing we're going to do is we're just going to pump her leg and just find some of those trigger points. So I typically like to start off with the glutes and then roll into the piriformis right there. You can feel that, right? Mm-hmm. Yep. Nice and easy. Just gonna find it. And again, by pumping this leg, it's gonna relax these upper hamstrings and then just let my finger glide right over that bump or scar tissue just to release that. Perfect. Once we do this, we're gonna use that hypervolt, warm that tissue up. Good, just relax. We're gonna open up, just get some mobility in that hip joint, the SI joint. Good. Perfect. Pressure okay, Jasmine?
Yep.
Good. Let's do this other side here. This side feels a little bit better. You drink enough water today?
Yeah.
Good. Jasmine's super coachable. She definitely listens to her at-home exercises as well as those ergonomic postural stretches. And then by utilizing that standing desk, just maintaining the correction, guys, is half the battle. You guys got to be coachable, got to listen to the at-home things. That way the treatment that's done in office can stand the test of time, especially with long weeks like she's been doing recently. Good. 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 Pressure okay still?
Yep.
Good. All right, next thing we're gonna do is utilize this hypervolt percussion gun here. Nice and easy. Follow that glute medius, the glute max here. Just work on that piriformis. Relax this SI joint. A lot of people love this. It's kind of difficult to do it on yourself. So if you do have a partner that can help, perfect. All right, guys, what we're gonna do now is adjust this pelvis. You're gonna see this piece underneath your hips pop up, just like this. Remember, that right leg is short. I wanna drive it back. So we're gonna go clockwise on this, just like here. Good, big stretch. Good, deep breath, all the way out. Good. Good release there, deep breath, all the way out. Make sure you guys watch the end of the video for Jasmine's tips for Netflix and some series. She's got a couple that we've been going through. We're gonna adjust the mid-back now, so deep breath in, all the way out. Good. Deep breath in, all the way out. Good. Okay, we're gonna adjust this right hip that's off. So lay on your left side for me, Jasmine. Good, perfect. Bottom leg straight. Bring these arms right here. Good, nice and easy. Just relax. Perfect, good. Other side. How was that?
Good.
So what would you say you've seen the most improvement with as far as functioning outside of work? Would you say your sleep's gotten better? Good.
Honestly, yeah. But also, like before, I struggled with like
Swing your legs to the left here.
wanting to like, after sitting all the time, my back would hurt a lot.
Yeah.
But now, and my shoulders, but now I honestly don't feel that pain anymore, which is nice.
Good. What would you say you like the most out of the other therapies that we do, whether that's from the decompression machine, your PT work, your trigger point, your corrective scoliosis, roll? What's your traction decompression?
Yeah.
It's a patient favorite. So what I'm doing now, guys, we're gonna adjust her neck and her lower cervical spine here, but I just want to relax that tissue, especially again since she's looking down repetitively. She's definitely tight in here. Once we do that, we'll go over those Netflix series. Good. Before we do that though, I'm just gonna palpate nice and easily. So side by side. Good. I'm just checking for that range of motion. Good. Perfect. We're gonna adjust this right side first. Good. Just relax your ear, my shoulder. Good. Drop your right shoulder. Perfect. Whew. That was good.
That was good.
Good. Turn your other right a little bit. Oof. Beautiful. How does that feel?
Good.
Good. Awesome. Let that set in. All right. So what everyone's been waiting for. What are the best series on Netflix currently?
I really liked Fool Me Once. I don't know if you've watched that.
Fool Me Once is good.
That was good.
Any others?
I'll be honest, I still have to watch the last episode of Griselda.
Griselda's a good one if you haven't seen it. It's like the female version of Narcos.
I the last half of the last episode.
And then you got one more?
Not yet.
Not yet? We'll follow up for the next video for the next one. But again, guys, thanks for watching this video. If you haven't already, make sure you hit that like and subscribe button. Jasmine, thank you for trusting us with your health. And we'll hope to see you guys in the next video.